If you're considering of getting a hair transplant, you need to think about this first. The majority of people think that FUE is going to be much more safer, but it's just as bad because there's permanent scarring on this patient here who now has to deal with it forever. Another example is this patient who just got a hair transplant and unfortunately his scalp got infected, meaning that he's going to have to remove his scabs, leaving him with more scarring. A common misconception is a lot of people believe that hair transplants are going to be successful on the first try and that you're not going to have to do any maintenance afterwards and you're going to be able to keep your hair. But that's actually not true. That's the reason why I urge a lot of people who start noticing any signs of hair thinning to immediately address it and start finding solutions. Because hair transplants come with many risks, and that's the reason why it should be left in the very last option until it's absolutely necessary. Taking a look at the Norwood scale, if you're about at a 3 or 4, at that point you still have a chance to get your follicles back, but if you're at a 6 or 7, unfortunately you're probably going to have to consider a hair transplant. About 90% of my patients that come in wanting to get a hair transplant, I actually refuse, and the reason for that is because their hairline hasn't gone back far enough yet, and if I fix their hairline in the front, it's going to start looking like this. Because they have male pattern baldness, the back of their hair is still going to fall out and they're going to have to come back multiple times. Something I started including in my practice for people who only have thinning hair is to swap over to using the Spectral DNC because it has 5% minoxidil. What we want is for our dermal papilla to work with our follicles and the surrounding areas that are showing signs of thinning so it can make it thicker. Topical minoxidil can work, but the problem with that is that it comes with a lot of uncomfortable effects on the side which no one wants to deal with, which is the main reason why I suggest my patients to use nanoxidil. Now results are always going to vary from person to person, but it depends how consistent you are with this to actually see some progress. So if you're balding or you notice any signs of a receding hairline, I'm telling you, try out the spray. I'll leave you a link so you can get one too.